Hello, hi. Okay. Hello and welcome to KP Health Hub Official. In today's section, I will explore the topic of oxygen therapy and essential part of patient care in many clinical situations. From evening onwards, I'm trying to put a live video from the software, but due to Wi-Fi glitch, it is not unable to do the live section. So I came through the YouTube for the live section. So I hope I will do the good live section with you all guys. And once again, welcome to the KP Health Hub official. So in this today section, I will explore and I will tell the oxygen therapy, and in that I will tell what is oxygen therapy and devices, what are all the uses for the oxygen therapy, and percentages of oxygen therapy in different what is a device uses in the hospital. If you are from nursing background, so mention your state or your name, or else if you're not a nurse or healthcare professional, also you put your profession in the chat box. Or if you are just normal public, if anyone watching, so please comment in my comment section. So let's begin by understanding the basics. So first of all, what is oxygen therapy? You need to know that what is oxygen therapy. So the oxygen therapy is nothing but is administration of supplemental oxygen to individuals who are not able to maintain adequate oxygen levels on their own. It is delivered through various devices based on the patient condition and need. So once again, I will repeat. The oxygen therapy is nothing but administration of supplemental oxygen to the individuals who are not maintain adequate oxygen levels in their own. It is delivered through various devices based on the patient condition and need. So let's move on to the indications of oxygen therapy. Why the patients need in oxygen therapy means hypoxemia, low blood oxygen levels is called hypoxia, acute respiratory distress syndrome, and chronic obstructive pulmonary disease, pneumonia or lung infections, asthma exacerbation and cardiac failure or myocardial infarction, post-operative recovery, and last finally anemia or severe blood loss. Once again, I will repeat the indications. What are all the indications for oxygen therapy? Hypoxemia, low blood oxygen in oxygen levels, acute respiratory distress or failure. COPD is nothing but chronic obstructive pulmonary disorder or disease. Pneumonia or lung infections, whether it is lower respiratory tract infection or whether it is upper respiratory tract infections, asthma exacerbation, cardiac failure or myocardial infarction, post recovery. post-operative recovery, those the patient need the oxygen therapy, anemia or blood loss. So next move on to the contraindications and precautions. So move on to the contraindications precautions. Absolutely there is no contraindication regarding to the oxygen therapy, but the healthcare person has to take care of the oxygen regulators and oxygen flow, how much they are maintaining. If too much of the oxygen is delivering to the patient, or if too much of the FiO2 will increase in the ventilators, will call barotrauma. So there is absolutely no contraindication for the oxygen therapy, but if the patient getting more oxygen means barotrauma or hyperoxia may be happen. So however, the precautions are necessary in patients with COPD. So those the patient with the chronic obstructive pulmonary disease, for that type of or for that kind of patient, oxygen level should not be increased. Why? Because the CO2 retention will be happen in that patient. So how much how much ml of the oxygen they need, only that much ml should be administered to the COPD patient. And move on to the other contraindication, premature infants, to prevent the retinopathy. And as I said, on the ventilator, those the patient receiving the oxygen, FiO2 should be according to the ABG levels. If anyone not knows what is ABG, I already did the live section on the ABG. You can find what is ABG, what are all the components in the ABG, and what are all the normal levels of the ABG. I clearly explained in my live stream. Go and check in my channel. My channel name is KP Health Hub Official. You can find the live section and move on to the next part. Yeah, the oxygen delivery devices in the hospitals. If you're not a what do you say, hospital staff or general public, where you visiting to the hospital or you going to the hospital, you can see the patient getting the oxygen through the mask, through the nasal, and through the pipe going into the mouth or into the nose. So these are all the devices comes under the oxygen therapy. In that, first oxygen device is nasal prawns and simple face mask. Second one is simple face mask. Okay, sorry. Yeah, first one nasal prawns, that is also called as nasal cannula and simple face mask. And third one is venturi mask for accuracy of the delivery of the oxygen. Those the patient need much amount of the oxygen. And partial rebreathable mask and non-rebreathable mask, that is also called high concentration mask. And HFNC, that is nothing but high flow nasal cannula. What is say that? FNC, high flow nasal cannula. And the last one is bivalve mask, that is nothing but ambu bag. Bivalve mask is nothing but ambu bag. So these are all the devices used for the delivering of the oxygen. I will repeat once again. First one is nasal prawns. Second one is simple face mask. Third one is venturi mask. And fourth one is partial rebreather mask. And fifth one is non-rebreathable mask. And sixth one is high flow nasal cannula, HFNC, and bivalve mask. So these are all the devices used for the delivery of the oxygen. And there is another separate setup will be there to deliver the oxygen. Those who are the patient cannot have the sufficient oxygen. Those who needed the continuous oxygen supplement therapy, and those the patient unable to maintain their tidal volumes, unable to maintain their CO2 and PO2 levels by own, they have to intubate, and so that they have to need the mechanical ventilator. So mechanical ventilator is a separate setup. So these are all nasal prawns and oxygen mask and rebreathable mask and non-rebreathable mask can be handled by the nurse through the through the putting of mask at the mouth or nasal area. But intubation is it is a separate invasive procedure. The endotracheal should be placed into the trachea that will connect it to the mechanical ventilator. So coming to the mechanical ventilator, each of these devices is selected based on the required oxygen concentration, patient breathing effect, and urgency of the situations. So now let's go through each along with oxygen concentration or FiO2 it can deliver. So before that, all we need to know that room air. In the room air, what is the percentage of oxygen? If anyone knows it, mention in the chat box. In the room air, how much of the oxygen percent is present? First of all, as a medical persons, as a nurses or as a anesthesia technicians, we or you all have to know that percentage of oxygen in the room air. Can anyone put in the chat box? So, the air we breathe normally has 21% of oxygen. The air we breathe normally has 21% oxygen. This is our baseline when no oxygen support is given. Understood? So, as in the room air, that is 21 percentage. So come move on to the nasal prawns, also now called as nasal cannula, are the most common low flow oxygen devices. Here, how much oxygen delivered at the different flow rates means if the patient getting 1 liter per minute, the oxygen percentage is 24%. If the patient getting 1% of the 1 liter per minute oxygen, he getting 24 percentage of the FiO2, and the patient receiving 2 liters per minute, the patient receiving 28% of the oxygen. If the patient getting 3 liters per minute, the patient getting 32 percentage of the FiO2. If the patient is on 4 liter per minute, the patient receiving 36 percentage of the oxygen. If the patient is on 5 liters per minute through the nasal cannula, the patient getting 40 percentage of the FiO2. And if the patient getting 6 liters per minute, around 44 percentage the patient will get the FiO2. So this method is comfortable and good for patient who need mild support. With the nasal cannula, they can talk. With the nasal cannula, they can eat. If the on the nasal cannula, they can drink. So they can do all the things without any interfering. And move on to the simple face mask. This face mask deliver more oxygen than the nasal pumps. So at 5 to 6 liters per minute, about 40% of FiO2 the patient will receive, and at 6 to 7 liter, around 45% of the FiO2 the patient will receive. From 7 to 8 liters per minute, up to 50% of oxygen the patient can receive. So the flow must be at least 5 liters to avoid carbon dioxide buildup. Who are on the face mask, simple face mask, at least 5 liters should be delivered through the simple face mask. So in order to avoid the carbon dioxide buildup. So move on to the next most common device the using in the hospitals is nothing but high concentration mask. High concentration mask. The another name for it is NRBM mask. NRBM mask, nothing but non-rebreathable mask, NRBM. So before that, all we have to know that what is breathable mask and what is non-breathable mask. For the breathable mask, the two ports will be made at the mask site for inhale of the environmental air. Whereas in the non-respiratory mask, there is only one wall. So what is the patient receiving the oxygen? That has to be only the patient inhale into the through into the lungs only. Okay. And coming to the NRBM mask, the device deliver up to 90 to 100% of the FiO2 at 10 to 15 liters per minute. If you put 10 liters or if you put 15 liters, the patient can get 90 to 100 percentage of the FiO2. So this is the most important mask for the ICU. Those the patient in the critical situation, NRBA mask will be used. So it include one way, one way valves and reservoir bag used in the emergency or critical care patients. So, and coming to the lastly, the mechanical ventilator, it provide continuous pressure oxygen control wherever from 21 to 100% of the SiO2 the patient can get through the mechanical ventilator based on the patient condition and setting. So now coming to the conclusion. So let's recap. Nasal prompts for mild oxygen needs, simple face mask for moderate support, venturi mask for the precision, and non-breathable and ventilators for the high or full oxygen delivery. High or full oxygen delivery. So these are the devices using commonly for the patient, those who require the oxygen continuously in the hospital settings. So if you are a common public people, you also have to know that what are all the devices using for the oxygen therapy. If you are admitted in the hospital, the nurse is putting the nasal prawns, you can eat, you can do the brush, you can eat the any snack item, you can drink the coffee, you can drink the any type of liquid. But in that place, if you receive the oxygen through the face mask, so you cannot take the coffee, you cannot take the any oral diet with the face mask because that has to be removed and you have to take through the mouth. So what will happen means, if you're removing the mask from your nose, your O2 levels will be dropped gradually. What will happen means your O2 levels will be dropped gradually. So you need immediate oxygen therapy. So you have to put the oxygen mask immediately. For the reason, nasal pumps is the best solution for the patient, those who are in between 1 liter per minute to 4 liter. If the patient getting 4 liters per minute, there is no use to put the simple face mask because at least 5 liters per minute to 10 liters we have to use a simple face mask. So that's all regarding to today's live section is regarding oxygen therapy. What is oxygen? What are all the devices and what are all the indications and what are all the contraindications regarding to the oxygen therapy? If anyone have any doubts, so mention your question in the chat box and please share this link to your fellow groups or to your social media so that I can get the good views and good reach. And if you are a nurse, please give a thumbs up. Or if you from the hospital setting, you can give a thumbs up. Or if you are from a normal general public, and you mention your area. And that's all regarding the today's live section. Thank you for watching this education video on KP Health Official. Don't forget to like, share, subscribe, and final one, click on the bell icon so that only you can receive all the notifications when I upload, when I doing the live for more healthcare insights. So finally, from my bottom of the heart, stay safe, stay informed. Thank you so much. See you, bye bye, meet you in the next live section.